Welcome to your nightly news on Mcb News. I'm your host, Bakdang Tran, reporting on a breaking news story about walking pneumonia. Presidential candidate Hillary Clinton was reportedly suffering from walking pneumonia when she buckled and lost her balance as she left the 9/11 memorial service on Sunday. We want to get you straight to the action. Here's Caitlin Constantine live at the scene.
Hello, thank you, Bakdam. Here I am in front of Hillary Clinton's daughter's apartment in New York City. After she left the memorial, she reportedly went to her daughter's apartment. Later on, she said that day, "I am feeling great. It is a beautiful day here in New York City." This entire incident has renewed speculation about Clinton's health regarding the presidential campaign. Candidate Donald Trump has personally accused her and attacked her and stated that she might not be well enough to run for president. He has even gone as far as to say she might be sleeping too much or is not well. The only question that remains is how much this will be of a setback to her campaign. Now back to you, Bakdam. Thank you.
Thank you, Caitlin, for that live update. And now we will take a closer look at walking pneumonia by having our questions answered by our expert, Dr. Post. Our chief correspondent, Becca, will be conducting an interview. Becca, over to you.
Thank you, Bakdang. I'm joined by our expert, Dr. Carly Post, here to explain walking pneumonia, its symptoms, and treatment.
Thank you for having me.
First off, tell us a little about walking pneumonia, such as its background and where it's found.
Mycoplasma pneumoniae was discovered in 1944 in a patient with atypical pneumonia. Eaton was credited with discovering a specific agent, coined Eaton's agent, as the principal cause of primary atypical pneumonia. At first it was thought to be a virus, but then it was proved to be a mycoplasma species in 1961. It has many unique characteristics, such as being the smallest organism capable of living and reproducing on its own.
Interesting. So what causes walking pneumonia?
Many types of bacteria may cause pneumonia, but walking pneumonia is a mild form of pneumonia, usually caused by Mycoplasma pneumoniae.
Can you explain the microbiology of pneumoniae and what diagnostic tools, if any, are used to identify the bacteria?
Certainly. M. pneumoniae is considered an atypical bacterial pneumonia because it has different symptoms, can appear different on X-ray, and historically the antibiotics commonly used to treat bacterial pneumonia don't work against it because it doesn't have a rigid cell wall. Mycoplasmas are spherical to filamentous cells, and fried egg-shaped colonies are seen on agar. The mycoplasmas are thought to have evolved by degenerative evolution from gram-positive bacteria.
What are the signs and symptoms of walking pneumonia?
The signs and symptoms of M. pneumoniae develop 15 to 25 days after exposure to the bacteria and develop for 2 to 4 days. The major signs and symptoms include a cough, mild fever and chills, a headache, sore throat, tiredness, and weakness. The cough comes in spasms but tends to not produce any mucus. Some less common symptoms include anemia, ear infections, and skin rash.
How do doctors go about diagnosing the disease?
Well, because the symptoms are so mild, some cases of walking pneumonia go undiagnosed. M. pneumoniae can be diagnosed after a physical exam by a chest x-ray, listening to the lungs with a stethoscope, or a blood test that can specifically identify the presence of Mycoplasma bacteria in the blood.
How is it spread from host to host, and there are different forms or types of the disease?
The disease is spread from person to person by coughing and sneezing. There are many different types of pneumonia which can be caused by different forms of bacteria, including M. pneumoniae, viruses, or fungi. In the case of walking pneumonia, the most common cause is the bacteria M. pneumoniae.
What prevention methods are in place, if any?
As with other respiratory diseases, M. pneumoniae infection is spread by coughing and sneezing, so prevention tips include covering your mouth and nose with a tissue when you cough or sneeze. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow, not your hands. Wash your hands often with soap and water for at least 20 seconds or the time it takes to sing happy birthday twice. If you don't have soap and water, use an alcohol-based hand sanitizer and allow time for it to dry.
How is the disease currently being treated?
There is no vaccine to prevent M. pneumonia infection. Instead, antibiotics are used to treat infected patients, but M. pneumoniae has increasingly demonstrated resistance to some antibiotics, which is why it is extremely important to follow your doctor's instructions and complete any antibiotic regimen that has been prescribed to you. Remember also that M. pneumoniae doesn't have a cell wall. which is why it's resistant to antibiotics that specifically inhibit bacterial cell wall synthesis. Although most people will recover from the illness on their own without medicine, severe complications can occur that require hospitalization, such as severe pneumonia, encephalitis or swelling of the brain, hemolytic anemia, renal dysfunction, and skin disorders. Immunity after the disease is not long-lasting.
Is there any new research on walking pneumonia?
I'm not aware of any specific research studies going on right now, but I do know there is a need for better diagnostic tests, including the development of a rapid, reliable, and cost-effective way to identify the pathogen at the office visit. We also need these tests to be more widely available at state and local public health clinics and laboratories.
So how many people are affected each year?
An estimated 2 million cases of M. pneumoniae infections occur each year in the United States. However, many infections are not diagnosed, so the actual number is likely higher, and the true size of the health problem is unknown.
Can you explain the epidemiology of the illness?
Well, there's no national reporting or surveillance system for M. pneumoniae infections, but outbreaks occur mostly in crowded environments like schools, college dormitories, nursing homes, and hospitals. Additionally, this illness is most common in young adults and school-aged children. People at risk for serious illness and complications include those recovering from a respiratory illness, people with a weakened immune system, or people with asthma.
Do you think Senator Clinton contracting walking pneumonia will seriously set back her campaign?
I can't speak to that, but I can say that Senator Clinton was at a high risk of infection. As a presidential candidate, she's constantly out in enclosed spaces, face-to-face with thousands of people, which is an ideal condition for the transmission of a respiratory illness. A positive outcome of her condition is that it resulted in this opportunity for me to be on your show and help educate the public regarding this disease, what they can do to prevent it, and what to do if they become infected.
Why should we care about this illness? What would your take-home message to the people listening at home?
Everyone should care about this illness because everyone can play a part in its prevention by following the tips I explained earlier. But if you work or live in one of the susceptible populations we already discussed, such as schools and college dorms and other crowded environments, then you should be especially interested in this disease and how not to get it. So my take-home message to the people listening at home would be simply to demonstrate good hygiene and proper etiquette when you are sick to help prevent the spread of this respiratory illness.
Thank you, Dr. Post, for your time and for sharing your medical expertise with us.
You're welcome, and thank you, Becca, for having me.
Back to you, Bakdang.
Thank you, Becca. That concludes our breaking news segment for this evening. Thank you for joining us here at MCB News. I'm Bakdang Tran.